everyone. I wanted to talk to you guys about administering oral medication to a snake, particularly the hognose. As you can see, this guy is he's pretty thin for a hognose. He's got like the whole triangular body thing going on, which is not supposed to happen. He hasn't eaten in a while. He has some flagellates in his poop. So we are treating him with Flagyl. In this form, it is orally. He's getting a dose orally for 5 days, once a day. So with hognose, they have a ledge. Let me see if I can show you. That bottom lip is tucked under the little ledge of his upper lip. So they're a little harder to get to, a little harder to open their mouths than, let's say, like a boa or a ball python or something where they kind of just have a line going across. You can open it up. First and foremost, you always want to wash your hands thoroughly before. I used chlorhexidine to make sure they're like really clean. And this guy, of course, I'll be washing my hands after because I do not want to infect any of my other collection. So, of course, wash your hands, have everything prepared. So I've got his medication in here and ready. And you're going to need a small utensil, most likely, especially if this is the first time you've done this. Nothing sharp, nothing pointy. You really don't want to hurt the snake. You're going in their mouth. So there's potential for, you know, of course, injuring their teeth, them losing teeth, accidentally shoving this in their airway, all kinds of stuff. So number one, you want to be gentle. Take your time if this is your first time doing it. Of course, you really don't want to stress them out tremendously, but at the same time, they need their medication. So do what you have to do to get it done as quickly and as safely as possible. So if it takes you a little more time, especially the first time, you know, if you end up having to treat a snake orally, that's okay. I mean, read them. He's pretty chill right now. This will be his third round. So he's done it before. He knows what's coming. My tool that I like to use is a bobby pin. Of course, they're not pointy on the end because they have those little caps. That keeps me from like really stabbing him and hurting him. You don't want to really use anything sharp. For larger hognose, I have heard that you can pull down the skin really gently from their jaw, but his jaw is pretty small. He's not the biggest hognose. It's hard for me to pinch that and pull it down, and I really don't want to hurt him. So my method is using a tool, which I'll show you in just a second. But of course, clean hands, have everything ready. You're probably going to need 2 people, one to hold and open the mouth and the other to inject. Whoop. All right, so let's get started. Of course, you want to hold him firmly behind the head. He's going to want to get away. Just try to keep his body supported, keep him held firmly. So next, I'm going to take my little tool and I'm going to go in the side and gently try to lift up his bottom jaw. He's going to get aggravated. He might actually open his mouth for me, which is what I need him to do. And I know you can't see this. Let me see. But I'm kind of going in the side here very gently, and he's most likely going to open up just from being annoyed. Come on, buddy, I know. But of course, gentle. Gentle is the main key here. You don't want to go just shoving this in his mouth. Open up, bud. Remember, the airway and the tongue are both on that bottom jaw, so you really don't want to, shove this in his airway. Be very careful. All right, he's starting to open up. All right, so now he's opened up. Once I've got him open, of course, I lay it flat. Oh man, I'll do it again. But once you have him open, the first hole you see is where his tongue will be. The hole directly after that is where his airway is. So that's his airway, that's where he breathes. And then after that, of course, is his throat where he eats, that goes to his stomach. So we want to, when I get him open again, inject this as far back into his mouth as you can. You don't want to put it in the airway. You don't want to really put it in the tongue. Put it as far back as you can to prevent aspiration. This is such a small amount. If it were to happen, he should be just fine. His lungs would be able to handle that. But at the same time, you don't want to risk it. Put it as far back as you can in his mouth. So let me get him open again. Come on, buddy. Open wide. You got it. Come on. Open up all the way. So, as far back as we could go. And he will be fine now. He's good.